I want to welcome you to another Facebook and YouTube Live. And if you're joining us for the first time, this live stream is all about supporting and serving the needs of nurse educators to give you practice-based strategies and best practice principles to strengthen how we teach nursing so our graduates are better prepared for practice and can successfully transition into the complexities of real-world practice. We haven't met. My name is Keith. I'm the founder of KeithRN, and it's my passion to create resources that really provide that evidence-based practice with unfolding case studies using Tanner's clinical judgment model and other resources to support the needs of nurse educators. So again, we really kind of put this prioritization. One of the things that I'm passionate about is to just reform nursing education so we really get back to our original purpose, which is preparing graduates for practice. And if we do that using practice-informed frameworks, evidence-based practices, the NCLEX can take care of itself. And that culture that wants to sometimes make all about the NCLEX and first-time pass rates, which I get it, if we put practice first, the NCLEX will take care of itself. And so I just want you to know that if you're joining us live tonight, welcome. I want you to just throw your name and where you're coming from in the chat. It's always great to see where people are coming from. And I just want you to know that myself and Maria, our nurse educator consultant, will be traveling across the country in the next week. As many of you know, spring is conference season for nurse educators. I don't know why there's so many of them in the months of April and May, but next week I'll be in Branson, Missouri, with the Nurse Educator Institute with Deanne Block, who does a wonderful job serving the needs of educators with all that she does. And I'm excited to just to present on some content relating to eliminating infobesity, professional identity, as well as going beyond transformation, but reformation. What does that look like? I'll also be at our state Minnesota Health Educator Conference that in April 9th through 11th, and then I'll be at Wisconsin in Eau Claire with a conference by the Wisconsin National League for Nursing, and that will be a virtual event. So I'm just going to share my link for that or their link for that, and if you, very affordable, very reasonable conference that they're providing, anybody can access it. I'll be doing a 3-hour breakout there. So anyways, just want to let you know that I'll be on the road and I hope to connect with you. If any of you will be in Branson, Minnesota, or Wisconsin, put it in the chat. I'd love to connect with you. And so as we look at tonight's topic, this is going to be a crucial conversation about clinical education and really what we're doing to strengthen the transition of a new nurse or any new educator for that matter to transition successfully from nursing practice to nursing education. And kind of one of the gaps in the literature that we're going to talk about tonight is that who's educating the educator in our nursing programs? And I don't mean that to be an offense. What I'm saying is simply this. If you're a nurse practitioner, if you're a nursing, if you're a staff nurse in practice wanting to check out adjunct teaching like I did many years ago, and just because I love to teach, we have to empower and equip the educator so they can successfully transition to this new role, which is very different. Because how many of you know, as a new educator, you go from expert nurse to novice educator, and that's a painful transition. And unfortunately, it's more painful than it needs to be. And we're going to talk about a scoping review in the nursing literature that was just published last year in 2024 on that very topic. And so I'm excited to discuss that tonight, and I'm glad you're here. And I just want to say welcome to our educators who are joining us live. I see this filling up the chat, so it's so great to have you all here. I don't have the time to usually just go, oh, welcome here. I just want you to know, thank you to all of you who are here, because really this hour-long conversation is really about you and your needs. And I'm just excited that you're here to invest in really kind of having a conversation and what that looks like. And I'm going to bring on a guest in just a couple minutes here, Lisa Gonzalez, who is one of my heroes in nursing education. She's well published in the literature, has some incredible practical evidence-based strategies on how to teach and develop clinical reasoning. She was also one of the primary content creators for our new clinical course that KeithRN has just launched yesterday, Bridging Teaching and Practice, essentials for clinical nurse educators. We'll talk about that later, later in this hour. And I want you to stay tuned because there's some really practical things I think you did some things that you're going to find really helpful in this new offering and how it can best serve your needs and the needs of your program to standardize and strengthen clinical education so our students are equipped and prepared to be better prepared for practice. But if we're going to prepare our students for practice, guess who else needs to be prepared? Our nurse educators. And as we know, it's a common and ongoing struggle. And so I'm just going to kind of just highlight one of the article that we're going to be discussing tonight is titled "The Transition of Clinical Nurses to Nurse Educator Roles, a Scoping Review," published in Nurse Education in Practice. And this article is a game changer. We're just going to highlight it tonight. We're going to talk about it. I'm going to introduce Lisa here in just a minute, and we're going to talk about the challenges that maybe you have experienced. Think about what you experienced as a new educator and what that looked like. And so as we talk about this transition, it's like we talk a lot about the academic practice gap. Right now it's a buzzword, that disconnect between how nursing is taught and practiced. But there's another gap that nobody's talking about, and that is the practice to academic gap. And that is the gap or disconnect between expert nurses, experienced nurses coming from practice, nursing practice, and going into academia. And that gap and that inability to transition successfully and to have the tools and resources to do so. I know that what's ironic is that I was a master's in nursing and education major when I got my master's or terminal degree. It didn't prepare me to teach in the clinical or classroom settings with practical nuance skills. I mean, the EDD is a great doctorate. Even a PhD doesn't teach an educator that emphasis in most programs. And so there's, a gap that we need to recognize exists. And I believe for every challenge we face in nursing education, there's also a solution. But, I'd like to ask those that are in the audience, why do we have the practice to academic gap? Because if we don't address that, how we're transitioning and training staff nurses and new educators who are expert nurses to practice, the academic practice gap is not going to be solved or is not going to be bridged in our generation. So, I'd like to get your thoughts as far as just why we have this gap. Why don't we support and transition our new educators more successfully? Because, the majority of our nurses, from the Scoping Review article, I'm just going to highlight some key findings here. Then I'm going to bring on Lisa to join us. These are the key things that we want to kind of just recognize as the problem. Clinical nurses transitioning to novice clinical educator roles have a predominantly negative experience. This Scoping Review article, 50 articles in the last 20 years that met their criteria about clinical nurse educator transition. Very large review, very rich. Almost all had a negative clinical experience in that sense of transitioning from a nurse to nurse educator, specifically this context for the Scoping Review, clinical educators. And that's where we get started, do we not? I know that's how I got started. And they recommend greater support and preparation strategies to ease what they call transition shock. We've heard about reality shock for our new nurses when they experience complexities of real world practice after they graduate. Same is true for educators. And without adequate preparation, our new nurse educators coming on board and teaching teaching in the clinical setting will struggle and go through incredible emotional, physical, and social discomfort and even trauma as a result of not being adequately prepared. And there is a clear consensus from this Scoping Review that clinical nurses require structured preparation to transition successfully into the role of a nurse educator with the students. But yet there's a lack of evidence to determine how we should structure that preparation. And that's why I'm really excited to share this new clinical course that's actually been over 3 years in the making, with Lisa Gonzalez kind of being my co-collaborator, and I'm glad to have her here tonight. And we're going to then basically kind of talk about, how we can help new educators successfully transition. And so there are some principles that every one of you, whether you're a program leader or an experienced or current nurse educator that is maybe newer or even experienced, your stories and your struggle. And so I'm going to bring on Lisa. Lisa, I want to thank you for joining us tonight and taking time out of your busy schedule. A mother of 4 children, and your husband's got is watching the kiddos. And so thank you for joining us tonight.
Because I love this conversation tonight. This is
important. Would you agree? Is this a hot topic, Lisa? And do you have any kind of as you look at what I shared with the introduction? I'm going to share some things of Lisa here, by the way, because Lisa has got some incredible, 2 of my favorite articles I'm sharing with right now that you can go to the abstract, download the full text from the library. One of those things. But Lisa, I'm just going to let you join, and then we're going to look at the chat. There's a lot going on here. So, we've got a lot of ground to cover. So,
well, first, I was wondering if you shared a link of that article that you were talking about, the scoping review article.
Oh, I didn't even do that yet.
If you guys click on it, it's actually a pretty quick. You can look through pretty quickly and see some of the things that Keith was talking about. It was a really interesting article, some of the things that they're finding. And I think it speaks to what we're all saying here, that we need some more programs to be able to develop faculty. There was a comment that I noticed in the chat, and it said many clinical educators are trained by other clinical educators who were not really trained as effectively as they should be. So I feel like this can be a really vicious cycle. And I know Keith had asked me to share a story about my experience becoming a new educator. So here, seeing that comment actually really resonated with me. So, I mean, I remember being a new educator, really wanting to help these students, and watching these students struggle and being very unsure about how I can help them. And I remember one in particular, she was doing care. We were doing care plans because care plans were really popular, and they still kind of are, but we were doing care plans, and they were just writing things from the care plan book, but it wasn't making a whole lot of sense with what the patient was actually, what was happening to the patient. I mean, there were some similarities, but there was other things they needed to consider. And I was like, gosh, this student is really struggling, but I don't know how to help her learn how to think through the nursing process, because that's what I knew it as back then. I wasn't well versed on clinical reasoning and clinical judgment. It was still kind of an emerging topic. And I just remember knowing instinctively, and this is after maybe about 1.5 years of experience. So I knew instinctively that this student needed something from me as a clinical instructor, but I just didn't have that skill or that tool or that know-how of what to do. And I remember turning to some of the other faculty, and it seemed like they didn't necessarily have any answers for me either. And so that person that in the audience, I didn't catch your name, that had said, it's almost like the blind leading the blind in a way. Yeah. If we're not taking time to invest in our own learning and then being able to train the next generation. So I remember leaving that situation feeling like I was not able to meet the students' need, but I didn't have any resources really to help me. And there didn't seem to be there was support for students in this program for certain, but it wasn't necessarily even the right kind of support to help the educators learn how to teach this nurse thinking, or to help support the students to be able to learn these clinical judgment and clinical reasoning skills. That was what was missing in this particular situation. So, yeah.
And the thing is, Lisa, when we even look at models of teaching and understanding clinical judgment, we must understand Tanner's framework of clinical judgment. And even that, when I go to conferences, how many of you are familiar with Tanner's clinical judgment model? It is, you'd be surprised how few hands go up. And it's that is a must-know framework, because it's a practice-informed framework that breaks down clinical reasoning, Lisa, as you would say it, piece by piece. the noticing skills, the interpreting skills, the responding skills, and the evaluation reflective skills. And so, unfortunately, Tanner's framework is open access. That can be, if you just Google thinking like a nurse, I think by Chris Tanner, 2006. She's the one who coined the term thinking like a nurse with that article in 2006. Google it. I'll find the link, Lisa, while you're talking, and I'll pop it in the chat just as a convenience to our audience. But would you not agree that that's really foundational to really, if we're going to lay a foundation of effective clinical teaching, we as educators need to understand it, and then we need to communicate it and teach it to our new educators, and especially our adjunct faculty who are, so tell me your thoughts.
Definitely. I agree, because it seems like really there's a few things here. There's one, understanding clinical judgment as a nurse, and then there's understanding the how do you teach clinical judgment. And so nurses, we learn this. I went to school and I learned clinical reasoning and clinical judgment, not intentionally. I just learned it. I learned it on a job. Somehow I figured out the instincts. You start to see patients decline earlier and earlier when you get that experience behind you, right? But to be able to teach it, then you really need to have a pretty good, thorough understanding of all the little nuances of clinical reasoning and clinical judgment. And it almost reminds me of, have you ever tried to learn like how to cook from an elder in the family, like grandmother, aunts, whatever? I remember I wanted to learn, my dad's from Cuba, so I had an abuela. And so I wanted to learn her recipes. And I remember going in the kitchen with her, and she cooked all the time and being like, abuela, how do you make this? How do you make that? And she would show me like, oh, you just do this, and then you just add a little bit of this. But there was no a list of a half a cup of this, a cup of this, a teaspoon of this. It wasn't like, well thought out. She just did it really instinctively. She didn't even know how to like describe it anymore. And so I feel like sometimes without having that, okay, this is what clinical reasoning is, this is what clinical judgment is, this is how to teach it, because then that requires a whole separate skill set of how do you take what you know and then now translate it to students. But I feel like that's a big piece too. So I feel like that foundational understanding for us and those tools to be able to translate that and teach it to our students is really important, and maybe what's missing from this puzzle.
Yeah, no, I completely agree, Lisa. And as you look at kind of like, this is what I really like this quote by Amy, who says this, Lisa: nursing is more apprenticeship. In the old days, in Nightingale's area, the trades had an apprenticeship. If you were a cobbler, a tailor, you had that formal apprenticeship. And wondering if she says the nuance is supposed to be like this, that the NCLEX question focus is just off to me. Anne, you're a woman after my own heart. You're absolutely right. It is off focus. And that's where I think we've lost our way. And the NCSBN is part of that, because many of the state boards of nursing require first-time pass rates to be at this standard, and we focus and obsess about that, but we're not looking at the bigger picture. And so I think that nursing practice isn't multiple choice. That is powerful.
And the nursing apprenticeship too, Keith. I mean, when you think of apprenticeship, especially there's other fields that have this apprenticeship type of model, is that it's a lot of time invested. You know what I mean? Because it doesn't just happen overnight. And one thing that I'm learning in my dissertation study, and I feel like we all know this, but is that the time element is such a huge barrier, because we're having to hurry up and teach all this stuff. And even if you get 8 to 12 hours of clinical, it takes time to learn this stuff. So I think that's a great idea about the apprenticeship model, but then what would that look like and how would we get there?
Yeah, I think it's twofold, Lisa, as we look at just the need for more clinical hours in nursing education, because that's where we had, you look back at the diploma programs and the culture of being hospital and practice based. I think we need to move back to that. I don't think we have to say we can never do that. I'd love to see diploma or some form of greater partnership. Maybe that's a more realistic goal in this generation between practice and education. And we're obviously allowed to talk about that. That's another whole topic. But I think that the residency programs, Lisa, this is my thought as we look at kind of those are optional now. Well, are they optional for medical students?
Right.
They get 3 years
Right.
plus, depending on now they have a much more comprehensive scope of practice, but they don't go from medical school and then a 6 weeks and then you're a doctor.
Right.
In nurses, we have just as much a responsibility of taking care of people, and that we hold their lives in our hands, because we're responsible. If we miss a developing complication, we can harm and even kill that.
Yeah, and we're at the bedside more. We're at the bedside more than anybody else, so absolutely. And regarding the residency programs, it's always interesting to me that there seems to be a difference between what is the residency program and what's actually orientation, because I've been hearing more and more about residency programs being offered in about a year long, and I think that is great. But what's happening in some of these residency programs is the nurse is still getting about maybe 6 weeks, 8 weeks of orientation, and then they're taking care of a full patient team. But they're still in the residency program for a year. But is that really what we are looking for, especially if we're thinking more about this apprenticeship and this taking time and how vital it is to learn and learn well and have that time to learn before you're responsible for such a big patient team with the safety and lives at stake here?
No, and there's a lot of great comments in the chat, Lisa. I'm trying to just filter them all at the moment and just kind of, this is my question to the audience. When you look at the transition that every nurse requires, just like how, a residency program in a perfect world isn't optional. But my question that just kind of keeps this splinter in my brain regarding this topic is that why is there not any type of transition program for a new nurse going into nursing education, but we're not even showing them how to teach. We're not even equipping or training them to be successful and to teach students well and to bridge this gap, because I think that in many ways, we're doing the best we can, but if we're not taught and equipped and empowered to use educational best practices, understand the importance and preeminence of Tanner's clinical judgment model, Lisa, and other core competencies that are related to the nuances of teaching effectively in the class, in the clinical, we just are, the culture in nursing education is just, you have to figure it out. And you don't even get that structured orientation or mentorship like many in the chat are sharing, which validates, that was my experience. I just got a bundle of articles that I had to kind of figure it out. I got a little folder. Remember, I got this nice folder.
Well, that was good. That was something I got. Somebody had mentioned a comment, and it reminded me of how sometimes scary a learning environment could be for students, and how that is almost part of the art of teaching, is meeting that student in clinical, meeting that student at their developmental level. I remember when I was a new educator, clinical educator, and I really meant well. But my first approach because I didn't get much guidance like a lot of us. And my first approach was, well, I'll just teach them like how to do nursing like I do nursing now. Okay, but now I'm an experienced nurse, right? So maybe that wasn't a good approach, but I'll tell you how it got implemented. So I remember one day we were getting close to the end of the semester, and I was like, okay, I'm going to give the student a real feel for nursing. We're going to do meds. And I decided that, I was going to kind of put some of the students on the spot, I'll call it, because that's what it felt like. The way that I did it was I was like, okay, we're going to do meds in real time like a nurse. So I got them and I showed them the meds, and then we went and got the meds. And then I was expecting them to prepare it in real time, in nurse time. And then I remember this student, she was brave enough to speak up, but I saw she was real nervous. We went in the room. I didn't give her any time to think, okay? Because I'm I'm going to teach them how to be a real nurse. This is pressures. This is reality, right? And so we went in the room, and she was drawing up the stuff. She was starting to shake. And she was I was like, what's going on? And she's like, I am so nervous. I didn't look up this, I barely got to look up this med. I know what it is, but like now we're going in the room and I feel like this is so fast for me and I'm scared. And I was like, okay, this is not the right approach. Like there's something then that I'm missing. And so what I learned eventually, and somebody had asked for a tip in the chat I saw, what I learned that is so important is that guiding, supporting approach. And again, I'm learning a lot from my dissertation, so this is something that's emerging right now, is that how you need to support and guide your students in their learning nursing practice. And so how much guidance and support? Well, that depends on the student. Well, how do you know? Well, that depends on your skill as a clinical educator to be able to assess your students, to understand the curriculum and where they're at in the program, to be able to, learn a little bit about them and how they learn best, and to be able to actually slow down the real time of nursing, because we have to embed in clinical education a lot of times to pause and let them think. Pause and prepare mentally to go in that room. Pause and review those steps again. And then do the skill, talk about it for 10, 15 minutes. You're going to go in there, do your thing, debrief that moment. How did it go? What do you want to improve on? What did you notice when you went in the room? What do you think the impact of this intervention is going to be? What are you going to look for? How do you know it's effective? How do you know it's not? So all of that takes time, but you have to be able to support that student regardless of where they're at. And I'm starting to think of it now almost like teaching somebody how to ride a bike. You can't just let them go right away. You have to kind of hold them for a little bit. And then you start to feel, oh, wow, they're starting to get their independence a little bit. Maybe I'll let go. Okay, let me grab them. They're not quite ready. Let me try letting go again. So it's really this kind of dance that you do as a clinical instructor with your student as far as helping guide and support their learning in clinical education.
Now, Lisa, that comes naturally to you because how long have you been doing this? For about, I'm not going to say how many years.
16 years? Yeah.
Now, what our audience needs to understand is that what Lisa just shared needs to also be taught to your novice and your brand new and almost, every educator, these principles that, again, are not intuitive. You don't just kind of like, oh, I need to give my students, I need to pause, I need to give them that time, I need to support them in this way. See, we need to teach them. We need to equip and empower our educators. And so, Lisa, that's where any of us who are expert educators as well as expert clinicians, we can be part of the solution in our own program by mentoring. Sarah Cano had a comment in the chat about how important mentorship is, and I couldn't agree more. And so these things we have to be intentional, Lisa. It's kind of like teaching caring. You can say, oh, I want you to be a caring nurse, but then you got to make it visible. You got to be intentional. You got to ask caring questions. How can you communicate that this person matters to you, and how can you as a nurse demonstrate that? We have to get it on the radar, and we as educators need to remember that what you just shared isn't intuitive unless it's taught.
Yes.
And your knowledge, it's kind of like, the storytelling, the narrative pedagogy. If we don't tell our stories, if we don't write it down, as well as discern and put together what our best practices for teaching in a cohesive framework or a presentation so that they can get it, it doesn't get transmitted. That's kind of where, if we don't tell the stories, Lisa, it's going to die. And so you need to be sure, it's kind of like, what you just shared and all of your things that you're doing are part of that, and again, there's so many educators who are so creative doing things well, but we as educators need to educate our new educators very intentionally. And unfortunately, it's not happening. And our students suffer. And not only do our students suffer, Lisa, but the patient outcomes.
Absolutely. But the good news is you can learn these skills. You can learn these skills. You can become, that's why they have now the certification exam for the clinical instructors, the certified nurse educator exam, I think, for the clinical instructors, is that these things can be taught and they can be learned and they can be practiced. So.
No, you're absolutely right. I want to transition. There's a lot, when we look at kind of like, I think it's time to talk about the consequences when you're not prepared well. And I'd like to know what the audience, kind of experience has been. But in this scoping review, they looked at 50 articles. Lisa, I'm just going to read just a bullet point list of what I discerned and discriminated from these, from what they published. It's simply this: the emotional impact of not being adequately prepared as a new educator was feelings of loss, disorientation, isolation, confusion, doubt, anxiety, fear, inadequacy, feeling overwhelmed, frustrated, guilt, and increased stress. That's the emotional impact. And out of that list, is there anything there that resonated with you when you look at your journey? And for anyone in the audience, I would like to know, just kind of just pop it in the chat. But Lisa, what resonated there with you as you look at your transition?
I feel like there was a lot of uncertainty. I feel like for me, I'm a firstborn child, so I'm a high achiever. I like to be good at things. And so that example that I shared with that student and feeling like I was not able to meet her need, that felt like a huge loss. And it felt like, is this a student? Because you have to make these decisions sometimes too, right? You're evaluating your student. So it's like, is this a student who just, doesn't have, I guess simply said, doesn't have what it takes, right? Which sometimes you have that. Nursing's not for everybody. Or is this just a student who needs to learn something and I'm not able to help them do that? And so for me, it felt like that sense of inadequacy. And confusion and just a lot of uncertainty. And, unfortunately, not only sometimes is there not enough support, but there's also a lot of blame, and luckily I felt like the situation worked. The situation was unfortunate, but I feel like in that situation, I didn't necessarily get a lot of blame from anybody except for maybe myself. But I have seen that where it's like, okay, well, we didn't support the person, but it's still your fault. Like, you didn't do what you were supposed to do, even though we didn't tell you how to do what we want you to do. So it's almost not really fair. It's not really fair to set somebody up in that way, I think.
Yeah, but we've got some great chatter in the chat. I don't have time to go through it all, but I just want to say thank you to those that are just, Sandra's talking about DEUs and how that, is again, kind of connecting practice with our educational programs. Ron Bolin had a great quote earlier. It got lost in the chat, Ron, so I apologize for that. I see that at the bottom now, somebody responded to it, and I want to thank you for sharing that. And
there's a lot of good stuff in here.
Yeah, there is. Celeste makes this comment about most experienced nurses or nurse educators are burned out on empowering their own students. They don't have enough time or energy for new nurse educators, which is sad. And that's one of the, we look at the physical impacts, Lisa, I'll just kind of close this with this thought. What they experience as a result of an inadequate transition, not only negative experiences, but relentless exhaustion. They don't eat well, they're sleepless, and they even lose a sense of their self and being so uncertain. That uncertainty, if you got a little bit of anxiety to begin with, it's crippling. And so, it just, you have all these self-doubts and you have the imposter syndrome. And it doesn't need to be that way, but you feel that way. And sometimes your feelings feel like facts, but they're lies, but we don't recognize it in the moment. And so I totally, for many of these things, and I was passionate in my early days as an educator, Lisa, but again, it took me time to figure it out as well. And it was an unnecessarily stressful time when I look at my journey. What I want to share here, just to bring us to a path of like, okay, we have a problem. I think we can all agree with that, Lisa. I don't think there's anybody going to say, we're not really doing the best job possible mentoring and transitioning our new clinical educators, even our new full-time faculty with the classroom and the simulation or other responsibilities they have. I think we all know that. I've seen it for years. That's why I began this journey with you 3 years ago.
Yeah.
to look at what can we do to better mentor and guide and have something that will be a concise yet streamlined resource with educators. We're going to talk about that here in just a few minutes, but I would like to kind of let's talk about the solution. And Sarah Cano had the first piece is mentorship. With the synthesis of this scoping review, this is the power of a scoping review. One article gives you 50 summaries and condenses it into a nice little digestible bite. So this article that I shared the link, it's a must read and it's full text. It's open access. Thank you to the authors who did that for us. So we don't have to, if I don't have access to a library database, you can still access it right now on that link that I shared. So mentorship. So mentorship is essential. And so that comment that they said, if you're already a stressed out, checked out, or burned out educator, you're not going to get a good mentorship from your colleagues in the department. That was my experience. I had an assigned mentor, Lisa, but she wasn't available to me most of the time. And again, it's not her fault, but it was just the reality. And I think Lisa was, I think that's a common experience. So if you're a program leader attending this tonight, look at how are you mentoring new faculty, because they need a mentor and they need someone who is going to really support them. So that uncertainty and feeling overwhelmed, they have a safe person to talk to debrief like we do in simulation, Lisa. We got to debrief with our new educators, check in with them, and don't just kind of give them a stack of PowerPoints and say, this is your content, go figure it out.
Absolutely.
Or in the clinic.
And there's always a lot of great ideas. Like sometimes mentorship programs or even like orientation programs, it's not just that you're connecting with like other experts, which is a great idea because you're going to learn from somebody else. But sometimes when you're having those meetings, like when I got my first full-time faculty job, I actually went there because they had a mentorship program. So part of this is like, we need to seek these opportunities, kind of, demand them, seek them. And so, but basically it was such a good experience because we had this little cohort of new people. And so we were able to kind of talk about things and go through together, because sometimes it's great to get that information and advice from that expert, but somebody had posted a comment about feeling like they're glad they don't feel like they're alone in this. And so sometimes having those people who are kind of at your level, struggling with you, sharing ideas, it just feels like that emotional support piece that scoping review talked about. It just lessens that anxiety and that confusion and that sense of inadequacy, because at least you kind of understand that maybe this is, you're not alone in it. And maybe this is kind of things that some of it is maybe things that you just go through, uncertainty when you're transitioning through a new role. So, that's kind of something to think about, I think, too.
So number one is you need a mentor. And like Sarah said in the chat, it needs to be intentional. It can't just be preferably not an informal, but a formal, assigned, and engaged mentor. Number two, according to the scoping review, supportive faculty. If you're a clinical educator, you need to have a supportive connection with the primary course faculty, so you can always be knowing what are they doing in their classroom this week or this semester. How can I reinforce that learning in the clinical? That was point number two. And the third and final point was that we need to have some form of formal instruction or course that can really, again, give your new clinical educators a standardized training and putting that all together. And, Lisa, I want you to share briefly about your dissertation study on the topic of, kind of on that same theme of courses, because that's really what you have helped me develop with, bridging teaching and practice, this online course that's asynchronous, can be accessed anytime, has not only the A to Z content in concise 30 to 45 minute modules with CEs, but also has the tools and some of your tools that you have developed on clinical reasoning. And so we're not just giving them teaching, but we're giving the tools to be successful and that embody best practices. Many of my KeithRN tools that I've developed over the years are in there, in addition to those of the content creators who are experts. They're already proven, Lisa. And I want to say thank you for sharing those. But I want to kind of just connect what you learned from your dissertation to the need for a formal instruction, and really kind of, without really even knowing it at the time, because again, I didn't start this journey creating this. This was 3 years ago, before this article was published. We just knew the problem existed. I saw it because I talked to educators at conferences across the country, and just having your finger on the pulse, it's obvious. And so you saw the same thing. And so just connect the dots real quickly to just kind of like, what you found with your dissertation and how that kind of connects to the importance of what the scoping review is sharing about formal instruction and educating our educators, especially who are new in the clinical setting.
Well, yeah. So my dissertation study that I'm still working on, but I have a lot of really good, strong emerging themes, but is focused on clinical education. And how do we effectively develop students' clinical judgment? So I interviewed participants who they were doing teaching strategies to develop students' clinical judgment. And what does that look like? Because there's been a big gap in clinical education. We're not effectively using that time and potential well. So what I learned is that it does require a lot of skills by the nurse educator in order to effectively utilize that clinical education learning environment. One thing that was really important is that the instructor has a sense of the situation. So let's say, for example, there's a patient and there's some clinical reasoning and clinical judgment that you need to teach that student to go through, to work through that situation with the patient, or, there's a complication, maybe an IV, something's happening, whatever, it's not always a life-threatening complication. Sometimes we could just start with some basic things, but the instructor needed to have a sense of that situation too, which means that the instructor needed to be engaged with the student and what's happening with the patients and being with their students and having these conversations. And so there's also that another thing that I have seen and learned through my study was that there is a little bit of judgment on the instructor's part about which teaching strategies they're going to use with the students and when. And really, they tailor these strategies depending on the developmental level, depending on the circumstances and the situation, what's needed for, what's called for. And so because, the more I'm getting into this, the more I'm like, oh my gosh, this is like a lot to think about how to do. But again, all of this stuff we can help our new instructors learn how to do. It's going to take some time, but so then really it gets back to that knowledge and preparation of the clinical instructor. So it's great to know, because this has been a huge gap in clinical education, guys. Like they've been saying now for, I don't know how many years, since there was a few monumental studies that were out there that were saying we have a gap in clinical education. We're task-based in clinical education. We're having missed opportunities in clinical education. Well, I will tell you, based on what I'm seeing in the study, is that these educators were actually shifting clinical education, and they were actually making a difference. It was not task-based anymore and task-focused. They weren't missing potential opportunities. They were actually embracing those opportunities. They had found some solutions to some of the problems that we've had in clinical education. But you know what? These were well-trained clinical instructors. And some of them were, faculty. They weren't just part-time, but they were also full-time. And so that was like a huge wake-up call to me. And, so one of my conclusions, go ahead.
So if we educate the educator, Lisa, we can equip and empower them to develop these higher level clinical judgment skills.
Yes. And if we don't, guys, I don't know that a lot is going to change about clinical education. And because clinical education is the real world, and that is a huge opportunity, like Keith, you had mentioned, how some of these older programs that were teaching them so much in the hospital, what were they called? Not apprenticeship programs. They were called diploma programs. Okay. Yeah. That's like one of the best places to learn how to be a nurse, is actually in the real world setting. But if we can't embrace and make that real world setting an effective learning experience, then what are we doing? And so we have to kind of, this has been our goal now for a while, guys, right? So we have to make sure that foundation is there. And so how do we do that?
Well, Lisa, I'm glad you asked, because you have helped me create a resource with several other educators, Sarah Cano, who's in the chat today, and the others, you know who you are. We've got a new resource called Bridging Teaching and Practice, Essentials for Clinical Nurse Educators. And when me and Lisa went into this about 3 years ago, you know, we wanted to solve some problems with this course. It wasn't just like, oh, let's create a course. It's like, no, we want to provide a solution that's going to train and educate the educators so that they have kind of a nice, like in one place they can access any time. It's not just like, oh, here's the next cohort on a, you know, that starts here in 3 months. It's like, no, you can take this right now. A lack of training, provide the innovative strategies, Lisa. And that's where I saw, you know, your value with your clinical reasoning and understanding of how to develop that in the clinical with your clinical reasoning piece by piece. We have to teach that. We have to distill it into, because a journal article can be kind of stiff.
Yeah.
They're formal and stiff. And if you're a nurse and you read a typical journal article, you will scream and maybe read a page or the first abstract.
They're hard to read. Yeah.
They are. So, you know, when we wrote this, Lisa, we made it very casual. I call it professional casual, just like you dress in the office. But we also want to provide the strategies. We also want to standardize clinical learning so that all of your educators get a standardized experience, but also if you have the tools and resources that you can all adopt and use in a program, for example, you standardize the learning experience, not only in your own clinical, because as you know, clinical can be variable, Lisa. All of those things, there's so many variables to clinical teaching. It's not always as good as you want it to be because patients go home, they get transferred. So we need to standardize clinical teaching with some downtime activities. I've got a ton of my own that are in this course. Lisa's got some incredible learning activities that are in the course. And again, improved student evaluation using Lassiter's rubric. Shelley Bassard has done some incredible work on that topic with reflective journaling, and her work is in this course as well. So we really took, you know, really some of the best in evidence-based practices, distilled it, and they were the authors of the content. I only developed, I think, 3 modules out of 20. And Lisa did 6. And between the others, 5 or 6 others, it was the 20. So what I just want to share with us, and Lisa, I'm going to have you jump in and join because some of this content is yours. I want to just provide an overview of this resource. I want you to check out the landing page and just learn more about the course and just what it offers. And if you have questions, we'll get to them. But I'm just going to open up the course and just basically let you know what's available so that we have something that is unique. There's nothing like this in the marketplace. And so let's kind of dig in, and I'll share my screen on there, and we'll just kind of go through this just piece by piece. What I want you to see at the very beginning is that this is 20 lessons, and I just want to kind of highlight the topics. And I want you to know we use the CNE clinical blueprint for the certification exam for clinical educators to basically create this framework. And I just want you to know that if you're we didn't mean this to be like a course for certification, but we wanted to start with the foundation, Lisa. Like, what does the CNE-CL expect a new educator or a clinical educator to know? Let's distill that. And so what we have here is the very first thing is the transition piece. So lesson 1 is all about strengthening transition to that new role. Lesson 2 is mentorship. The first 2 were Sarah Cano who wrote those. Forming a professional identity. We put that in the very front because we want to develop our students, not just to have not just to think like a nurse, Lisa. They need to care and act like a nurse and to embrace that transformational identity. And this is Nelda Godfrey, and I had a colleague of Nelda Godfrey help review this content. Janet Menegal wrote this content, and very well done, and really gives practical strategies how to teach caring and other things that we can do to really strengthen our students' identity. Then we lay the foundation with the foundation for clinical teaching, look at best practices, connecting learning with curricular outcomes, preparing for your first day, looking at designing an effective clinical day. And Lisa, I believe that one was yours, designing the effective clinical day and facilitating learning in clinical.
Keith,
And
can you go up real quick and can I
yes,
highlight something? So these I think were neat. Lesson 4 and 5, I think especially because with new educators, one of the things is you need to kind of get to know the nursing program a little bit. There's certain things about the nursing program that spill into clinical education. A lot of nursing programs, there's going to have some kind of structure. I think somebody had mentioned that. So these 2 modules help you learn how to learn about your nursing program and then make those connections in clinical or use those curricular maps or understand that there's learning outcomes that are supposed to be met. So I just wanted to highlight that part.
No, that's a great point. And, Lisa, while I'm here, let me open up lesson 4, because what I want to show you is how these courses are set up. They have the same exact structure and framework, and they're really unlike anything in the marketplace. So for example, you have the introduction to just introduce the topic, but then you have a video summary. And then you have an audio transcript, like a podcast of the entire lesson. So that let's say you just want to redeem your downtime, access it, listen to this lesson. You don't have to read it, you can hear it. And then we have the download tools. We have basically all of the tools that are included. There's over 50 tools over the 20 lesson, an average of 2 to 3 specific downloadable tools that you can download. And then there's some learn more articles. So if you want to go a little deeper or some other links, we highlight the best. Here's some Sigma resources for clinical nurse educators. That's on the web. And then there's CEs. So every lesson, whether you do just one lesson or all 20, has its own independent CE that you just need to click that and then go to the fill out the form, and you basically then are able to what did you learn? What would you do differently? It's very simple, not burdensome, and then submit it. And that can be used as a documentation for a program leader if they want to know if they took the course, if they assigned this course, those CEs are then sent to them. The other thing that's kind of unique with this course is that we wanted it to be interactive. So for example, what you're going to see here is that we've got, for each, we also want to decrease cognitive load. So everything is in drop downs, but you can scan it to see the subtopics of this topic of laying the foundation. So for example, you can just simply down click it and just read that section. There's a downloadable document right here. Always the blue call to actions are something to interact with whether it's a key takeaway, a tool, or a pause and reflection. And so they all have, in essence, these pause and reflect. What this does is that if you're a new educator, we want them to interact with the content, not just kind of read it like, some of those things that we do that we just have to do. We want them to engage with it. So if they just basically, when they click that answer here, it takes them to this downloadable form that actually is built into the lesson, where they fill out and they can submit their response. And then when they complete the entire lesson, submit your answers. And they can submit that, it goes not only to them, but also goes to anyone else they want to send it to. So if you have a mentor, this is a really powerful way to just communicate, let your mentor see what you're learning, what your takeaways were, etc., and what that looks like. And so,
Keith, there's a question that I think would be what you probably would love to answer. Is somebody asked what time is needed to do this? Is it one lesson per day or is it per week? Would you know what for the pace?
Okay, if you want to Netflix binge watch it, you could do this in about 2 or 3 days. Remember that each lesson has a CE credential, that they're fully accredited globally. And so this can be used internationally if there's people from Australia, England, or other English-speaking countries that would like to learn more. But a typical lesson is 0.5 to 0.75 CEs, and they're independent. So that's about 30 minutes, 30 to 45 minutes. And so, one lesson, take a break, but you could simply go through this like reading a book. It's really meant to be an online course that captures the essence of what we want our students to, what we want our educators to learn, to really, again, lay that, kind of equip them for practice and what that looks like. And so if we're just to kind of continue to scroll through this very briefly, the teaching and learning section, how to facilitate learning in clinical. How do we engage our students in clinical so they don't just kind of like stand around? How can we be intentional? Preparing them for patient care with practical strategies of time management, prioritization, managing challenging situations, is talking about incivility and other kind of things that come up with students who may be unsafe, remediation, all of those warts in clinical education, how to manage those are there. And then clinical judgment. And Lisa, this is your content. So I'm going to kind of, what I want you to see here is that we first lay a foundation of essentials to develop clinical judgment. And I think this is really important. And I want our audience to kind of see what this looks like. Again, you have all the information here on the right-hand side with the video summary, audio script. You've got the tools to download, and you've got some learn more. You've got the form. But really, when you look at the content, Lisa did a great job of we talk about practice readiness. How do you develop clinical judgment? We look at the 3 reasoning processes that we look at of critical thinking, clinical reasoning, then we define them. So again, that basic teaching of understanding what critical thinking is in order to develop the clinical judgment. Understanding the content is so important to laying that foundation. We talk about some practical worksheets and how you can connect Patho to practice with one of my worksheets. I've got some of my YouTubes in here and other videos that are the best of the best on clinical teaching, but again, helping our students understand cardiac output, look at clinical reasoning. And one thing we do, Lisa, throughout this course, it doesn't get better than Tanner's. And we really situate Tanner's clinical judgment model throughout the course, and then her article to download, etc. And so then we talk about the outcome of clinical judgment and what that looks like, the importance of caring, some interactive questions. And so again, it's digestible, it's scannable, and it takes about 30 minutes per lesson. Now, Lisa, I can't see any questions, but are there any questions?
There was one, because we were talking about how this would be nice, a course that would be nice to go through with your mentor. So somebody had asked, how would you go about finding a mentor? So I mean, my suggestion, so like I had shared before, like if I'm going to do something, I want to do it. And I know that I need people and I need to learn. I need people to be willing to teach me and I need to learn. And so mentoring is really important. So for me, I think it's really important if you look for a mentoring program. Now, a lot of schools, some schools I'll say have them. So if your nursing program doesn't have one, like Sarah Cano had mentioned, this is a passion of hers. It's really important to think about developing a mentoring program. Now, if you don't have a formal mentoring program, at least you can find somebody perhaps within the nursing program. I know for us in our program, a lot of times the full-time course faculty become like the informal mentor for any new faculty coming in. So find somebody who is willing to teach you and help you learn and grow. It could be somebody in the nursing program. It could be, somebody else even outside of the nursing program. I mean, we have this great group, Teachers Transforming Nurse Education, this Facebook group. Wouldn't it be fun if we got together and did some kind of, mentoring initiative? But I feel like we need to support each other. And so even if you have to kind of seek that out, I feel like you usually can find one person who you connect with who's willing to help you learn. But one thing that I think when they were developing the module that I read, and I thought that was really interesting and actually something to consider, is when you are looking for a mentor, it's better to have more of not somebody who's like in too high of a position of power, because that could be really intimidating and there could be some power dynamics there. And so it's better to have somebody who's kind of closer to your level, who just happens to have more experience than you or whatnot. So maybe other people have some ideas, or even you, Keith.
Yeah. No, that's, you've touched the bases, Lisa, and but great feedback. I'm just going to kind of just quickly highlight the remaining lessons just to kind of give you an idea. So under the module of developing clinical judgment, there's that essentials, that basic knowledge you need to know to understand to develop clinical judgment. Clinical paperwork essentials. This is one of the places we have a lot of infobesity in nursing education. And so what I've developed are just a number of numerous tools that can teach and develop clinical judgment, a clinical judgment concept map, clinical paperwork, is strengthening problem recognition, connecting patho to practice, lab planning, deepening the knowledge of labs by understanding what a lab does, and then what does a nurse do to respond to it as a plan of care. If something is abnormal, like an elevated creatinine, what will be your nursing kind of plan of care with a bad lab? We talk about that. This worksheet is there, the meds to master. We even have an alternative clinical reasoning activity. If you look at kind of the scannable pieces here, one of the things that we have here is that you've got to deal with downtime. All of these worksheets can be one page, very concise, deep learning activities, or dealing with too many students. If you've got 8 to 10 students, one of the things that I've developed many years ago when I began my clinical education journey was an alternative clinical assignment based on some of the principles Linda Caputi developed back in the day. And she had some great strategies that I just adopted, made it my own. And this takes 2 students off the grid of patient care into a alternative assignment where they can learn and go deep in the chart, dig deep into clinical reasoning, and put that all together.
Can I say something about clinical paperwork, Keith? I think one of the things about clinical paperwork that speaks to the instructor, and you're only one person and you have a lot of students, is how you design that clinical paperwork, how you implement it is really important, because it's almost a way to guide your students' thinking and clinical experience, even if you can't be with them at that moment. So clinical paperwork can really support you as a nurse educator, especially ask the nursing program if they have clinical paperwork to help with your students, to give to your students, because then that can also be a support for you as a new educator. Is a lot of times these clinical paperwork assignments, they might have prompts and ways to teach students how to think, how to collect information, things that they need to do while they're in clinical. So it can be a support for your students and for the instructor as well.
Yeah, and what I'll share here, Lisa, what I meant to share this earlier is that, to kind of get a comprehensive scope of a downloadable document that you can share with other educators, and just to see the value of the tools and the lesson topics, I've got a one-page document that has all of the lessons, the different tools under each lesson. As we work down clinical judgment, it's asking the right questions. Again, using Tanner's framework, we operationalize those powerful questions to deepen and develop clinical judgment. Then deepen and teach clinical reasoning piece by piece. This is Lisa's article where she operationalized that principle, as well as using concept-based activities. And just, working with Ann Nielsen to just, in her work on this topic that's in the nursing literature, using concepts like oxygenation, perfusion to guide clinical teaching, with a worksheet that Ann shared on oxygenation and gas exchange. And then how to eliminate clinical paperwork. Did you know that you can eliminate clinical paperwork with an oral care plan? How do you get there? Well, Beth Corner, who developed this strategy and shared it in the past with Keith and Facebook Lives, has got her own module on, again, just weaning our students from clinical paperwork to an oral care plan where they do it verbally on their feet in real time. And so, Lisa also included some of her worksheets that she's developed with the teaching clinical reasoning piece by piece. Is there anything? I know that we're kind of over here, Lisa. We'll wrap it up in just a few minutes. So stay with me, as I just wanted to share a closing piece. But is there anything else that, Lisa, that you wanted to share with the teaching clinical reasoning piece by piece?
I mean, I put it together. This is something that we've been using in my course, and I have a booklet that I put together the lessons for our clinical instructors. And so over the years, I've gotten a lot of really great feedback that when new clinical instructors come in, it gives them kind of a framework of how to approach teaching and learning. So I've included a lot of different learning activities in that little booklet that I give the clinical instructors. And I put
there it is right here.
Yeah, I mean, this course was going to be too big if we put everything in there, but this is like getting you started in like essentials and the basics. So it's basically how can you structure clinical so that way every week you're kind of hitting on a topic that's helping develop students' clinical reasoning and clinical judgment. So there's the winning combination is to make sure you explain that topic for them, give them some guided learning opportunities, give them some time to practice, give them something to think about and actually to do. And then to have a lot of debriefing time to revisit that topic and things that they've learned, because they're going to learn a lot of different things depending on the patients, and they can compare and contrast. So it just puts a little bit more structure to clinical education that's centered on developing clinical reasoning.
Yeah. And you put it all in a concise format, Lisa, so that, when we worked through this and got it distilled onto the online course, it again was just simple, but yet captured the bullet points, correct?
Yes.
Yes, ma'am. And then the final section, feedback and evaluation. You can kind of see how it flows from the beginning of transitioning, laying the foundation, teaching and learning, clinical judgment, and then finally feedback and evaluation. Look at how to give feedback. That's Rachel Salguero. Thank you, Rachel, for your contribution there. Shelley Bassard did lesson 19 and 20, reflective journaling to evaluate clinical judgment. And using that journaling, Shelley has done some incredible work in the nursing literature. And so she has shared her knowledge, how to use Tanner's clinical judgment model as a framework for reflective journaling, that noticing, interpreting, responding, reflecting. And then finally, we finish it up with evaluation. Evaluation is always going to be inherently subjective, but how can we use Lassiter's clinical judgment rubric that aligns with Tanner's? And you know what? You can see Shelley's lesson that closes it out, talking about evaluation, being fair, traits of successful students, evaluation methods, clinical evaluation tool, and using Lassiter's. Lassiter is, again, an incredible document that Kathy Lassiter developed, and she kind of had some reviewing of this course as well and provided some feedback for me, Lisa, just about 3 days ago. She took a look and said, "Oh, be sure you do this, Keith." And I did it, Lisa. And what's nice that Kathy shared and gave me permission to share with her rubric is not only the rubric itself, but a scoring worksheet that goes with it. And she even had a 10-minute podcast audio on how the Lassiter clinical judgment works to evaluate not only students in simulation, but also in clinical.
That is going to be a great treat. Now, I did want to say, go ahead.
She shared that with me for my dissertation on her that would use the LCJR to adapt it to case-based learning. And so she gave me consent. It's now in the course. And I just want to say thank you, Kathy, for all that you've done there. And then we've got just some appendices that you can see. There is another clinical judgment course that I developed earlier this year for 5 free CEs. There's a total of 18 CEs in this course, Lisa. And so, we have done a lot of work. And let me just kind of come off here and let me just.
That's definitely your faculty development for the whole year, if not 2 years.
Yeah. And so, I just want to, basically kind of just close it out to just kind of let you know that, we just launched it last week, and actually just yesterday. I've been finishing up all these details. But what I want you all to know, I guess, really as we look at this in the big picture is that, we both saw the need, Lisa. We developed a resource. Really, this is a structured framework. There are some great resources on the internet, and there's some things that maybe your program's already using. This is just meant to give you kind of like a complete in-the-box mentoring, training, instruction that I think with the combination of all of the tools and your resources and those that contributed, it really gives you both the teaching and the tools. And now it's just a matter of saying, let the market decide, kind of like Shark Tank. And you know what? I'm still a boutique brand. I'm not a big player in nursing education, but those that know me, they do appreciate just all that we do to really serve your needs. That's my passion. That's my heart. It still is there, though I'm tired and getting gray. So I just want to say in closing that what we do offer over opening week is a 3-volume set. These are ebooks. I have the paper version with me of our Think Like a Nurse textbook series that really goes deeper with your students to understand the importance of holistic care, student success, incivility, goes into the professional behaviors. And what's nice about these ebooks that you'll get, it's $130 value on the KeithRN store for free in the first week, is that it provides you with basically, it goes deeper. We talk about incivility in the professional identity module in lesson 11, or lesson 3, excuse me. But this is like a whole chapter. So you can go deeper if you're an educator. It's written for students, but educators will find value in this ebook series. And the volume 2 is all about laying the foundation of professional practice. That's the knowledge. You got to know your path, though, how to do a concise nursing assessment, your labs and meds. We just kind of, it's a work text. I don't have, and I just want you to know that if you'd like to just kind of see what the, kind of what these ebooks look like and what you'll get with that. If you purchase in the first week, is basically there's the store link for more information as well as a curriculum map. As an educator, it will deepen your knowledge, but it will also benefit your students as well. And finally, the Think Like a Nurse Volume 3 is developing the clinical judgment for professional practice. These theme of professional practice readiness that also align with the NCLEX, by the way. But really, my passion is preparing for practice. It always has been with KeithRN. That's kind of my unique value proposition, I think, to nursing education, is really creating those resources to inform practice. And that is all about clinical judgment, problem recognition, breaks down Tanner's clinical judgment model, chapter by chapter. So if you're a new nurse educator, even though it's for students, this will lay a strong, it'll kind of build on the course. And that's what I really want you to see with the ebooks that we're providing as a value for you all, is that it's going to take the course content and allow you to go deeper with it if needed. And then if you like it, it's also written for your students who are a new nurse, a graduate nurse, nurse residency programs are using, especially volume 3. And I'd be glad to, if you are interested in a preview copy, I'd be glad to send that to you just at keith@keithrn.com. And so I just want you to know that's our launch bonus. And so the course itself, I'll be honest, if you go to the landing page, it's at $295. I would say, what do you pay for a good conference? $500 to $600 plus travel. And I just want you to see that even though I know that nurse education, I tried to price it at a price, but I have invested a lot of money developing this. This is not, you can see it was very well done. I'm a perfectionist, and so is Lisa. We have spent an incredible amount of time on this resource. And I just want you to know that, this is all about your needs. My passion is to be an innovator and to transform nursing education. If you've been following me, I haven't changed, I'm just tired. And so I just want you to know that we haven't had a new resource with KeithRN for 7 years when we launched the Think Like a Nurse membership in 2017. I have nothing like this. I've just kind of been spinning my wheels, just keep going, doing what's needed. And now it's like, this is a new offering, and we're going to basically build on this course in the future with a classroom equivalent, and that we're going to have, for academic full-time educators, of course. And our KeithRN Hub is kind of like a evolving platform that will continue to grow and evolve with new courses that are really not just a bunch of voiceover PowerPoints and put on, you just have to kind of watch for an hour and there are no handouts. This is very different, very different. And I want you to see that difference, I hope, with what I shared here. And so I would just like to know if there's any questions that any of you have. I want you to know that, we offer programmatic discount if you have 10 or more adjuncts that you say, boy, our adjuncts could benefit from this. The bottom line is that we also, have discounted pricing of 25%. And so if you're interested as a program leader or just want to share this with a program leader, here's the link to our quote form. It's technically for our Think Like a Nurse membership, because we didn't have a form yet developed. We've got many platters that we got everything done, but there's a couple loose ends. That's one of them. This will work. We'll receive it. Just put it's for the clinical course, how many adjuncts. And Maria, our nurse educator consultant, is glad to do a demo for any program that's just remotely interested and go a little deeper with it. We kind of scanned over. I just kind of wanted to give you the highlight of it and give you some value with some great information that we shared earlier in this. And so, my goal was just to kind of accomplish both. I know we kind of have a lot of information here. But again, as we look at the need, if you have questions, pop them in the chat before we're going to wrap it up here. I want to thank you all for this. A lot of people still here, Lisa. So
yeah, I'm here
that.
in the corner. I don't know if you could see me anymore. I'm behind Celeste's box here, the comment box right there. But
you know what? I'm so sorry. You know what? I didn't put you back on the screen. It's like, what am I thinking?
It's okay. There was a question that I thought maybe you want to answer. It says, is there a time limit to do the course? They're working on changing our curriculum, textbooks, plus learning activities. So I have lots on my plate. So basically the reality of nursing education is that you want to have a course for enough time to be able to actually dive into it. And it might take you a few logins to really get into it because we have busy schedules.
Are you talking about Sandra Taylor, Lisa?
Yes.
Yes. And Sandra, it's annual access. It is a membership platform that gives you 12 months to access it. So I think that you'll get through it, hopefully in your first month. And then you have the tools and resources. Most of them are downloadable that you can use. And the membership is an annual renewable membership. One of the nice things about this online course, Lisa, is that because it's online, it's continually updated. So I don't know, I'm going to kind of find a rhythm of monthly or quarterly, but I get all of the key nursing journals. I'm going to preview them. And then when we have a new update, I'll share it with those who have purchased the course every month. And so it's continually going to be current. It won't go out of style. And that's kind of a cool feature that this course will offer any nursing program or nurse educator who just wants to, again, just strengthen their transition. We have a solution. And, look at the feelings that many of us have experienced in nursing education, the stress, overwhelmed. This can be something, I know there's a price to it, but it's, there is a value to it. And I want you to see the bigger picture of the value. And we, definitely kept it affordable. Comparable resources that are out in the marketplace are much more expensive, some even twice as much. And I don't want to, I want to find a balance to make it affordable to an individual as well as to a program who has a lot of adjuncts. They want to improve their practice. And again, remember that if we improve the practice of our adjuncts, our students are going to benefit from that. Their learning will improve and their practice readiness will improve. And so I really want to know if we can do this well as a community of transformational nurse educators, we can make a difference, one educator at a time, Lisa. And so I just wanted to share, Lisa, do you have any closing thoughts or anything on your heart?
I saw, the comment, especially before, about the pacing. So if you guys are thinking about how to pace this realistically and you're working with your new clinical instructors, one of the things that's kind of neat about how we laid out the modules was that there's sort of, there's like modules where you might do them at the beginning of the semester because you're finding a mentor and you're getting ready for clinical. And then as clinical is really getting in, you're really getting into clinical, maybe you start pulling those other modules about, okay, how am I going to use some learning activities and engage students? And then you have your evaluation type of modules towards the end. And so you might be able to pace it a little bit throughout the semester. So it kind of guides you through a clinical semester, really, from start to finish.
No, you're absolutely right, Lisa.
So I hope it's helpful. I mean, I put a lot of effort into this for sure, because I just want
we've spent hours.
Yeah, I just want to be, hope this information is helpful. I'm really sympathetic because I know how difficult it was as a new educator. And so if we can just kind of give our new educators a heads up, or even dive in deeper as experienced educators, what else is out there? Because I know I'm constantly learning new things. So.
Yeah. No, and there's just just a couple quick closing questions, and one for you, Lisa. I'm going to jump in real quick. Number one, Sandra, you had a question about the membership, and if you're a Think Like a Nurse membership, which is we only have one membership platform, now we have two. So if you're a Think Like a Nurse membership, this is a completely different resource, but you get a 25% discount. So it's about $225 per faculty if you're already a Think Like a Nurse member, which I think your program is. So thank you. But that's basically kind of like, this is a very unique offering with the course component, but it takes all of the clinical tools, most of them in the membership of Think Like a Nurse, into this resource, plus twice as many, about 25 to 30 additional tools that aren't in the membership. So it's really a unique kind of comprehensive yet concise platform for nurse educators. And so I hope that makes sense. If you have any questions, my email is Keith@KeithRN. Don't hesitate to reach out. And thank you, Diane, for using the membership. I thank you that's more of a comprehensive solution that's got 300 case studies and everything from A to Z across the curriculum. And that's another unique platform that we have that we didn't talk about tonight, but that's for another day. I want to focus on clinical education and all the hard work that we've all done, Lisa. You have gone through the outline over and over again, and I just want to thank you for polishing this to really make it. I mean, as you look at this, how do you see it from your vantage point? And the final product, did it meet your expectations, or how do you see it?
I think it's a really good introduction. I mean, it has kind of multi-layered. It has a good introduction for new nurse educators, but it also has enough content in there even for experienced educators. So I feel like in a way it kind of goes through, I guess, kind of get us all on the same page a little bit. Like there's from start to finish, there's information just that's going to be helpful for clinical education across the board, I think. And so I think if we can kind of all, get on the same page and develop these skills and learn more, then, I mean, there's so much we can do. But I saw somebody ask about connecting. So my email is you can do my work email, and that's fine, ligonzalez@csmd.edu. I also have another email, but I don't have that one memorized. So if you want to connect, feel free. I'm always happy to have a conversation and chat. So
yeah. And, I will just share in closing, one thing I forgot to mention about the course, Lisa, that every module by the educator who created it also provides their contact information.
Yes.
Their email in every lesson, including mine, so that if an educator who is like at home and has a question or even a challenge related to the lesson topic, because these educators are experts in their wheelhouse on that topic, would be their forte. So if you have a question about any of Lisa's content, Lisa, you are an ally of any nurse educator. You will respond to the emails, will you not?
Yeah, don't be scared to email us. I think a lot, like we're all, that can be intimidating sometimes to reach out and email somebody you've never met before. But I feel like, we're all just real people. We want to talk. We love, our areas that we know about, our expertise. And it's fun to be able to have people to talk about it with. So, reach out to us via the email.
Absolutely. And so the bottom line is that it also forms just a very informal way of mentorship for any new educators. Like, I got a question, just email the educator, just like you do on a journal article. It's like I reached out to those that who wrote the scoping review and just said thank you, and they're from Australia, and thank you for the work you're doing, and just so yeah, you do the same thing, but you can ask a question and you'll get a response. And we want to support educators any way we can, and this course will provide that support. We may offer in the future, for example, one of my visions, Lisa, for this I haven't talked to you about, but is that once we get it launched and kind of see where it goes, again, it's like, I don't know yet. I'm just by faith. I'm walking by faith, but I think it's on the right path. We'll have like 2 weekly sessions of different days, different times, and we'll have kind of a Facebook virtual meet. And if you're in course, come on in. If this day doesn't work, we'll offer the same thing, and we'll have a short teaching and then Q&A hour every, twice a week, and just let anybody who wants to come in, it's available. So, my goal is not just to give a course and to just say, okay, here's a course, purchase it. No, it's about here's a resource that can support you. And then I'm glad to lead that. And if we have a topic on clinical judgment, I'm going to lean on you to lead that and
That
have
could
you.
be a lot of fun and a great way to make connections
It's a
with.
great way, Lisa. I love that. So, my heart is to just, again, support our new educators. They're the future, just like our new, because we're getting old, Lisa. You're young yet, but the average age of nurse educators is in their late 50s to early 60s. They're not going to be in the trenches forever. So we got to take care of our new educators so we can mentor and support them. And, again, we'll just take this a step at a time, but this is our best effort and we'll just kind of see what happens. And if those of you that see the value of it, please share this word of mouth, and share the link. Let people know what we have, because again, I'm just a kind of I'm not corporate. I'm just Keith, the boutique Etsy brand, serving the needs of educators with the best possible quality resources. So appreciate all you do. Lisa, thank you for joining us tonight. It's been a pleasure. And thank you all as educators for the difference you're making. Really, those that are served are greatest of all. And even though you're tired, weary, and overwhelmed, you are making a difference and it will be worth it. And I'm just blessed to be able to support your needs. And thank you for all that you're doing. Have a wonderful night. Lisa, enjoy your children. Your husband, have a good night as well.
Good night.
God bless. You bet. Take care.